Hi, everyone, and welcome back to Allied Health 102, Introduction to Phlebotomy. Okay, so this is the last chapter that we're going to cover for our next lecture test. Chapter 9 and 10 have already been placed on Canvas, so you guys, like I tell you in lab and like I tell you on Canvas, if you want to be successful, not just in this class, but when you make your way to clinicals, not only will this make you really good at your job when you're at clinicals, and remember, it's a long-term job interview, right? Our goal is to go into Willis-Knighton or Ochsner's or Minden Medical and have them be so impressed with our knowledge and abilities that they ask to see our badge, make a copy of it so they can keep up with your name. So when you're done and they have a job opening, they call you, right? And that's what we want. So not only will it help you with that, but as I tell you guys all the time, also included in Allied Health 211, which is the clinical portion of your rotation, you will also have a class where you review back over all the things that you have learned in intro to phlebotomy, so that you will make sure that that knowledge is locked in your mind for not only for you to be the best healthcare worker you can be and the most professional and knowledgeable one you can be, but also when you take that ASCP registry exam, you will knock that test out of the park, okay? So remember, we start all our chapters talking about learning objectives, right? Because anytime we're doing something, we should have goals and objectives, right? And so listed in the front of your textbook is these learning objectives as well. And remember, you read your chapter, so read chapter 11 in your phlebotomy handbook, which is your textbook for this class, and then watch this PowerPoint presentation. And as you're watching it, I always tell you guys, have out your black binder, turn to chapter 11's review guide so you can fill those in, and then you use those review guides as your study material, okay? And then you read over and read over and read over your review guides, okay? So when we finish reading chapter 11 and we finish these PowerPoint presentations and we finish studying our review guides, we will have learned all these things, right? Everything from describing the reasons for acquiring capillary blood specimens all the way down to talking about making a blood smear, okay? So be familiar with these learning objectives both here and in the front of your textbook so you know what will be expected of you. Okay, the first thing is iatrogenic anemia, okay? Now, what is iatrogenic anemia? This is an anemia that can result from too frequent or too many blood samples being taken from a patient. So if we see that this is going to happen, whether this is a very ill patient in the hospital and they're having a lot of blood drawn, if this is a patient that like a neonatal infant who has a smaller blood supply and they're sick and being stuck a lot, this is something we want to reduce the likelihood that they will form this anemia from having too much blood taken from them. So remember, that's why we work really hard on our case studies for phlebotomists to understand that they have to work together with other healthcare workers when we're taking care of patients to make sure we avoid that type of anemia. Also, sometimes doing a capillary blood stick can reduce the likelihood of a Sharp's injury. It can reduce other injuries to adults, such as nerve damage when you're drawing blood through venipuncture. Injuries to children. There's been cases of cardiac arrest, hemorrhaging, venous thrombosis, other things like this. You can also have incidences of gangrene setting in on a wound, damage to the surrounding tissue, which can lead to organ issues, infections, and also when you have to restrain a child or you're trying to hold a child down and they're flailing around, they could accidentally hit their head or harm themselves. So these are all reasons we might want to choose capillary over venipuncture, okay? Also, it's perceived as being less painful. I don't know that I would agree with that. It is a less cost. It's faster to do. We say that, but then when we're in lab practicing collecting it, until you get that art down really well, it surely doesn't seem quicker. But It can be when you get the process down. And when you're talking about people like diabetic patients who are stuck often checking their blood sugar often and then having to sometimes inject insulin, it's just an easy way for them to accomplish that. Okay, we're still on these indications for why we would use skin puncture. Okay, guys, so it is especially crucial, right? And we talked about this, to only draw the smallest amount of blood needed for our laboratory test, right? On any patient, okay? If we're drawing blood on any patient, for any reason, we always want to draw, of course, enough blood so that we can run all the lab tests that we need to run, because we certainly wouldn't want to not collect enough and have to go back and stick them again. But we all know that a little bit of a blood goes a long way in most cases, and you just want to collect the smallest amount. And it's especially important when you're talking about people with a lesser blood volume, such as neonates and children, right? Also, skin punctures are used if the blood volume required are small and when the following conditions occur in adults, okay? So there they are, everything from that sad picture there of a severely burned child, if you're having trouble collecting blood from a patient who is morbidly obese, all the way down to point of care testing, right? When we talked about earlier with diabetic patients and those glucose monitors where they can monitor their glucose constantly, that would be a way, one of the real reasons to use that skin puncture. But make sure you're aware of all these reasons that's listed on the screen here. Okay, so you can also use skin puncture, like we said, when there's testing requires that small amount of blood, right? And we will go through certain tests that, like I talked about earlier, hemoglobins and hematocrits, things like glucose testings, these really good point of care testing systems that are in a lot of physicians' office labs, that can be used in patients' homes, where they really just don't need a lot of blood. We're talking about small, minute amount, and so it makes sense to go ahead and use a skin puncture. Now, when we don't want to use skin puncture, right? That's when the testing is the opposite, right? When it requires a larger amount of blood, which is usually the case in larger hospital instrumentations, reference labs, and things like that. They just require more blood than you can obtain from a skin puncture. If the site, their fingers, a lot of times people's hands will swell really bad, and you wouldn't want all that interstitial fluid to dilute your blood sample, okay? And when you're dealing with diabetics, if they have poor peripheral circulation, and they lose feeling in their fingers, or it's numb down there, you really just want to avoid that. So make sure you understand the times when something would come up that you would not want to use the skin puncture as well, including tests that skin punctures are not recommended for, okay? And you guys will need to know these, right? And a study tip is the ABCCDE, right? Okay, from ammonia, blood cultures, your coagulation studies, and those things like PT, PTT, fibrinogen factor assay, right? When you're going to do a cross match, any type of drug studies, and the SED rate just requires too much blood to be able to use a skin puncture. Here's one of our case studies, right? This is a time when you guys are taking all the knowledge you're learning in both lab and lecture, and you're putting it together to make sure it's clicking with you, so you can see if you could handle these situations correctly when you're out in clinicals or on the job. So you guys pause this case study, read through it, and then see if you're getting the correct answer. And remember, you can reach out to me anytime by text, email. You can talk to me about it in lab. Make some notes while you're watching these. Make some notes on questions you might have, things that you don't quite understand. I'll be glad to go over it with you. So pause this one now. And remember, we talked about this, right? Using the least amount of tubes and the best tubes, and what color tubes should be drawn, right? We're talking about this specific case study. So make sure when you're working on your case studies, you're pretending as though this is a real scenario out in the field, and I want you to answer the questions suited directly for this case study, right? So if the best tubes to draw are a green top and a purple top, and then if I were to ask you to put them in order, please make sure you put them in correct order, but just worry yourself with the ones in this particular case study. Okay, so we talked in lab about this as well, the composition of capillary blood, okay? When you acquire capillary blood, we talk about specimen source, right? That comes from a vein, it's venous blood, right? It comes from an artery, it's arterial blood. And if you stick the skin and puncture the skin, whether on the heel or the third or fourth finger, right? You are going to get capillary blood, right? And remember that capillary blood is a mixture of the blood from your veins and venules and your arteries and arterioles that all come down to those capillaries, right? So remember that it has, between the cells is that interstitial fluid. That's why we always wipe away that first drop of blood. But remember, and I talked about this in lab, that the blood you obtain from a skin puncture really has more makeup of the arterial blood than venous blood, because we know that arterial blood, we have a pulse in our artery, right? There's more of a push and pressure behind that arterial blood, so more of that gets into that capillary area than the venous, so consequently it has a little bit more of an arterial blood makeup. Okay? And remember, we talked about this. This is why we always want to note our specimen source, right? We want to let the nurses and doctors and other healthcare workers know where this blood came from because of the difference in the composition, right? Capillary blood specimens have lower values of potassium, total protein, and calcium, and they have higher values of glucose than what we normally see from venous blood, right? Because of this, we always want to put that on the requisition form. Here's another case study. So you guys, I want you to understand how these work. This is mimicking a situation you may run into as a clinical student or as a working healthcare worker, as a phlebotomist. And we want to make sure that you're getting all the knowledge you need from both lab and lecture to be able to go through this and be able to make the right decisions. So pause this case study, read through it, see if you're getting the correct answers. Again, on any of these, if you run into issues or problems, reach out to me. Pause it now. Okay, so one important step in the skin puncture procedure is to ask about hand preference, right? The preference site for obtaining capillary blood specimen, as we talked about in lab, are that fleshy central palmar surface of the distal phalanges, which is your fingertips, right? Of just the third and fourth finger of your non-dominant hand. Remember, in a perfect world, this is what we want, okay? Now, we know we never use our thumb because it has an artery in it. We know we never use our pinky because it has that bone, and we don't want to take the risk of actually hitting that bone and causing osteomyelitis, right? So we know that it's important, right, to warm our site and to choose the appropriate finger and then choose the appropriate site. So, because remember, that puncture should be made slightly off center of the thickest fleshy part of that finger, right, towards the end of the finger. The peak is sometimes calloused and puncturing the bone is less likely. Okay, so for infants less than 1 year old, right, neonates, the recommended site for skin puncture is the lateral or medial plantar surface of the heel. Remember, we talked about this in lab. We never puncture straight on because we can run into the issue of piercing that bone, right? So the following sites are not recommended for skin puncture, okay? So we want to go through these and make sure everybody understands where we would not do skin puncture. Some of these, and I'm bringing them up because in the past they were used. We no longer do this, right? We don't use earlobes, okay? We don't use central arch or the posterior of the heel. We don't use infant fingers less than 1 year old. We don't use that pinky finger, right? We don't use the thumb. We talked about why on both of these, and it's listed up here. We try to stay away from that index finger, which is your pointer finger, because it is more sensitive and most of the time it's more calloused, right? We stay away from any swollen, infected, or if we can avoid it, and the only time you usually can't is with diabetic patient, previously punctured, and then exact sites. You never want to hit that exact site if you can get away with it, right? And then we want to try to stay away from fingers or arms on that same side as a mastectomy, right? If they have any, because it's more, if they've had lymph nodes removed, they have more of a stasis of that lymph. They can have swelling. They're more prone to infection, right? And we never use the plantar surface of the big toe. These are just never done things, right? So make sure that you understand these, okay? Here's another one of our case studies. So what I want you guys to do, again, like I said, we want to make sure that you're able to put all this together so when you face these situations out in the clinical field, which you will make the best decisions. So pause this, read through it, and see if you're getting the correct answers. Okay, so there's things that we want to do to improve the chances of us being able to make sure we were able to collect the blood we need from a skin puncture, right? We've been over this in lab multiple times. First and foremost, we get 7 times more blood from a warmed finger, right? So you want to warm the site. And then methods of warming those sites. There's those commercially available methods that I showed you guys in lab where you break the little seal and the chemical reaction takes place inside there and it warms up, right? Heel warmers, you can have the little flap on it so you can actually attach it to a baby's heel. There's other methods. You can have heated surgical towels or heated washcloths, and you can use that on a vein site. But especially in our extremities, like our hands and fingers, they get much colder. And so you want to make sure that site is well warmed. Okay, so when you wrap on something around a site for about 3 to 5 minutes, that arterial blood flow can increase up to 7-fold, which can help with the blood flow, right? Also remember, lowering that arm down and swinging it just a little bit will get that blood flowing down to the tips of the fingers, which can help in making sure there's enough blood down there in the tip of the fingers to improve the chances of you getting your blood drawn and drawn quickly. So here's another one of our case studies. Also, guys, keep in mind that when you're pressing on your finger so that you can get that big, nice, pregnant drop of blood, right, to make your slides or to collect it in a micro container or other collection device, make sure that once you collect that drop of blood by capillary traction, it goes into wherever it's going into, release the pressure on that finger so that blood can then flow back down into that finger. Then you can start pressing again hard so you can get your next drop of blood, okay? So that's important as well. So you guys pause this one here, okay, and go through it and see if you're getting the correct answers. And remember, whenever they order a differential, we know that we're gonna get that purple micro container for that CVC, right? But we also need to mention that we're gonna make those 2 blood slides. Because remember, when you order a differential, it takes 2 properly made blood smears, not just 1. So now let's move on to cleansing our site, right? We chose the appropriate site. We know when to use it, when not to use it. We know what tests that can't be used for. We went over all that. Right now, as always, right? Cleansing our site, right? We want to make sure our site is clean prior to puncturing our site, whether it's venous or a skin puncture for capillary blood. So we use 70% isopropyl alcohol, and it's allowed to dry thoroughly, right? Because when we don't let our alcohol dry, okay, it can cause rapid hemolysis of our sample, okay? It can contaminate the glucose determinations, which means we'll be reporting out some erroneous glucose results, right? It stings, and it's going to sting our patient, which we won't want to do, right? It can also prevent the formation of that big round drop of blood that you need, which is just going to make a bloody mess, literally, and make it more difficult for you to collect your sample, okay? Not to mention, it leaves different microbes on the skin that could then enter the skin and cause an infection. I can't stress to you guys enough how important it is to clean your puncture sites thoroughly and allow that alcohol to do its job, okay? Now, iodine or betadine is really not recommended for disinfection of skin puncture sites because it can cause, right? We know it's an interfering substance and it can cause falsely elevated potassium, phosphorus, and uric acid. PPU, right? Stinky. Think about that for your study tip. And I say I'm giving you study tips, guys, because if you want to be successful on these tests, you've got to watch these PowerPoint presentations, fill out your review guides, and then study your review guides. Okay, now we have case study slides and then we have thinking slides, right? We know this. And these are slides too that you can use to study for your test, right? It's a way for you right now to pause this, read the question, then see if you're getting the correct answer. So pause it now. Okay. So now we're going to talk, and there's some great pictures in your phlebotomy handbook textbook that shows you the process for acquiring capillary blood. So guys, make sure you read those chapters. These are companions to these PowerPoint presentations, and it will really, really help you tie all this together. There's some great illustrations in that textbook. So important points to remember for skin puncture, right? Decontaminating the site, as always, allowing it to dry and do its job, right? Holding that lancet perpendicular to the finger so that it cuts across the fingerprints. If not, that blood's just going to run inside those fingerprints. And just like if you don't let your alcohol dry, it's going to prevent you from having that really good drop of blood, right? You want to wipe away that first drop of blood because we know that can be diluted with that interstitial fluid, right? Blood smears should always be made first. We talked about this in lab, right? And then your containers that have additives in them should be gently inverted 20 times to mix the blood with the additive. So when you're talking about an heparinized micro container, like a green top, a EDTA sample container, like our little lavender or purple top, once you've collected those, and remember I showed you guys in lab, when you touch the micro containers to that drop of blood. Remember, you want to just touch the big pregnant drop of blood to it, right? And it will, by that attraction, it will come into that micro container. And then what you need to do is gently tap it on the table so that that drop of blood can drop down into that container. And then if it has EDTA or heparin in it, you want to swirl it around a little bit. This gives you time to let off of the finger to allow that blood to pulse back into that fingertip. Then you can press down hard again, get your drop of blood, and repeat the process. Okay? And remember, when filling capillary tubes, blood flows into those capillary tubes by capillary action. And we've seen that happen in lab, right? And if you don't touch it to the finger, but just touch it to the drop of blood, that big round drop of blood, it will flow right in there. Then you can, again, like I said, ease up off the pressure and then apply pressure again and get another drop of blood. Same thing with that scoop, right? So you want to hold that puncture site downwards, right? And we don't do any excessive milking, right, or massaging of the finger. And we don't forcefully scoop that scoop that's on our microtainer across the blood or across the finger, right? Because if you're pushing, if you're milking and milking and milking, you're going to get excessive tissue fluid in there. It's going to dilute the sample or hemolyze it, and then you're putting out some erroneous results, right? And remember, always follow all manufacturer instructions on proper filling of any collection container. Because remember, a lot of those point of care testing or physician's office laboratory wave testing, they have their own specific collection device that goes with that particular instrument. And you always want to make sure you read your manufacturer's instructions and understand that you use what came for that instrument. And remember, we talked about this, we've done it in lab. When you're filling those capillary tubes, you cannot have air bubbles in the tube, right? And I showed you guys, and you went through the process of wicking that blood back down to get that air bubble out, and then continuing to draw your blood, keeping that tube held horizontal to make sure that you don't get the bubbles in there, right? You always want to ensure that bleeding has stopped before applying your bandage, right? So a lot of times I tell you guys, get them to hold a little gauze on their finger while you're finishing up what you're doing. And then once you're finished with that, then you can check that finger, make sure that it stopped bleeding, and put your Band-Aid on it. But remember, children will put their hands in their mouth. We don't want them to choke on that bandage, so we would not want to put that on a small child, right? And remember, the average depth of skin puncture should be 2 to 3 millimeters for adults, and they have set lancets for that depth that are for adults. And then there are certain lancets that are less than 2 millimeters, usually around 1.8, that are used for small children and infants to avoid injuring the bone, right? So make sure when you're sticking small children and infants, you're using your facility's appropriate type of lancet for that situation. And remember, when sealing those capillary tubes, and we went over this in lab, you push it into the clay to seal it, you rotate it a little bit, and then twist it before removing it, right? And we keep our finger over the end of it as we go down into our clay, right? Just like when you were a kid, you would put your finger over the top of your straw, and you could peel it up out of your beverage, and then you would let your finger go, and the liquid would fall out of the straw back into the cup, right? That's the same situation here. You need to, once you've filled your capillary tube up with no bubbles in it, place your finger over one end of it, and then put it down into this clay sealant. Remember, all specimens, including these microhematic tubes, must be labeled appropriately and immediately right there at the patient's bedside before leaving their room. And also keep in mind that repeated puncture, the bone can lead to osteomyelitis, which is inflammation of the bone due to a bacterial infection. That's why we avoid that, right? And remember, the micro collection tubes are a different order of draw than our venous vacutainer tubes, right? So let's talk about the order of draw for our micro collection tubes. So as you can see on here, right, our EDTA specimens for hematology, our little purple tops, are done first in order, right? Caveat, we always do those blood smears first, right? So if it's a CBC with a diff, we make our 2 blood smears first, then we collect our blood into our purple top. Now, the reason that is because, as you know, a complete blood count includes counting of the cells, right, including the platelets. Excuse me. And as you guys can see, when you're collecting this capillary blood, it can take a while, right? So you want to make sure you get it into that EDTA sample first so that it doesn't clot. The longer it goes on with you collecting this blood, the more likelihood that blood is going to start to clot. So make your slides first, then collect your purple top. And remember, you touch that drop of blood to your scoop, the blood, not your finger, right? It will lead into that scoop. Excuse me, guys. And then you tap it gently so that it will fall down in there, and then swirl it. And then make sure, once you've collected all your specimens, you gently invert those micro collection tubes at least 20 times, okay? Okay, so once we've made our smears and collected our purple top, then any other tubes that have additives in it, especially anticoagulants, right? Because we're collecting it in a tube with an anticoagulant, whether it's EDTA or heparin, because we want to do this on blood that is not clotted. So consequently, a finger stick is going to start clotting quicker. We want to get it into those tubes first. And then any of those non-additive tubes like a red top, right, or a gold top, that we don't care if it's clotted, we will collect those last, because if some micro clots are in there, it's not going to matter, right? But it will when we're talking about trying to count our platelets. So make sure you keep that in mind. We know we have our picture of our flower, right, that gives us our order of draw when we're drawing vacutainer tubes, and that is completely different than when you are drawing blood from a capillary stick. So you guys make sure you keep that in mind. Here's another case study, so you guys pause this one, read through it, and see if you're getting the correct answer. Remember, 20 times. So we see that there's some differences, of course, in collecting capillary blood versus venous blood, right? Our order of draw is different, and the amount of times we gently and completely invert our tubes are different, right? So now let's talk about microhematocrit and hematology specimens, okay? We understand that the packed cell volume, the PCV, or microhematocrit, can be collected directly into capillary tubes containing heparin that should be filled 2/3 full, right, and sealed at one end with our clay sealant, right? Hematology specimens can be collected directly into our tubes, right, our microhematocrit tubes. Our purple or lavender tops, same thing, they have EDTA in them, and as we now know, we collect those first, right? And then we have heparin, okay, tubes as well. But the reason we don't use, and we talked about this before, a green top or heparinized tubes is because they distort the cell morphology and can interfere with the staining technique. So this anticoagulant should be avoided when doing any type of hematology studies. Blood smears are made first, right, using the following procedure. Now, we've went over in this in lab, and there are some great pictures in your phlebotomy handbook, in your textbook. So you guys make sure that you look through this. We're doing this in lab as well, right? We're going to do these in lab. So first thing we do is we perform our skin puncture appropriately, right? We take all those steps that we went over to perform our skin puncture in the right way. Including wiping away that first drop of blood, right? Then we press our finger hard, get a drop of blood, not too big, right? And we touch the slide to the drop of blood, it'll be the second drop of blood, right? And if you'll see from this picture, over to the right-hand side is that square edge. That's the edge that's usually white or frosted. That's where you write your patient's name, the date you made the slides or collected the blood, and your initials as the person who collected the blood and made the smears, right? You want that drop of blood to be as close to in the center of the slide as you can, as close as you can to that end of the slide, right? Okay, and then, so we have that drop of blood on there. We'll have our spreader slide out there. Remember, you use a fresh, clean spreader slide with each time you make your smear, right? So we set that spreader slide in front of the drop of blood, right? Then we take a finger of our other hand that's obviously not holding the spreader slide, right? And we place it on that frosted or white end of our slide to hold it in place. Put the spreader slide in front of the blood, okay? You're going to have it at an angle. You see that 30 to 35 degree angle of the spreader slide, right? Then you're going to bring that slide back into the blood smear. As that blood touches that blood smear, it's going to start moving across that spreader slide. As it does, quickly and evenly, not putting a lot of pressure down on it, but still holding that 30-degree angle, you want to slide that spreader slide all the way forward off the end of the slide, okay? If your smear is too short, you want to make the angle smaller, okay? It means you're holding that slide up too high. If the smear is too long and it goes all the way off the slide, because we want the spreader slide to smoothly and evenly go off the end of the slide where our blood's on, right? But we don't want our smear, once it's done, you want it to fill up about half of the slide, but you don't want it to go off the edge. So if it does, okay, you want to make the angle a little larger. You got that slide down too far close to the other one, okay? Once you make your slide, right? And remember, a good smear it ends in a nice feathered edge. I've showed you the guys that in lab. It covers about half of the slide. It's smooth when you look at it. It doesn't have any ridges in it or lines or holes. And it goes from that thick end down there near where you put your drop of blood it gets thinner and thinner and thinner until it feathers out to that nice feathered edge, right? You want to allow those slides to air dry, right? We don't blow on them because that'll cause bubbles. It'll make moisture in there because we know we have moisture in our breath, right? The site must be always warm prior to collecting capillary blood from a child, always, for pH and blood gas determination, always. This increases arterial blood flow to the area and decreases collection time. The tubes must not contain air bubbles, just like we talked about before, and this is collected in what they refer to as a Nadelson tube. It is a bigger, it's similar to our capillary tubes that y'all have seen in lab, and I showed you an example of this Nadelson tube. It's a bigger, longer tube, okay? And it comes with what they call a mixing flea, and they call it a flea because it's a little bitty, teeny, tiny steel wire, right? And that once you've collected your blood in that Nadelson tube, okay, then you place that tiny wire in there, and then it's used to mix the blood with the anticoagulant by drawing the flea back and forth down that tube with the magnet outside the tube. So obviously the tube will be sealed, right? You put that flea in there, use the magnet that is now on the outside of the tube, and you run it back and forth down that tube, and it mixes that anticoagulant with the blood, okay? So remember that mixing flea, okay? So here's a little clinical alert we want to talk about. Okay, so hemolysis, right? We're talking about this clinical alert still, right? So hemolysis is the enemy of the phlebotomist, right? And we know that hemolysis, whether in venous blood or capillary blood, can cause erroneous lab results, right? So ways that you as a phlebotomist or anyone that's drawing capillary venous blood can do to avoid hemolysis, okay? Now, these are some things, they're not allowing alcohol to dry. We know that's for anywhere you're drawing blood, right? And using alcohol to clean, which we always clean our sites, whether it's venipuncture or capillary puncture, right? But here are some things expressly done when you're collecting capillary blood. Excessive milking of that finger, okay? We don't want to do that. That can cause hemolysis. And excessive mixing of the specimen. Remember, I told you guys, when you invert your tubes, whether we're talking about our venipuncture tubes or our micro collection tubes, you want to tilt them gently all the way over and back. No shaking or excessive mixing it can cause hemolysis. So here's another one of these slides. It says think, right? So these are you putting things together, because remember, our final in both lecture and lab is a comprehensive final. So you guys have got to put all this stuff together and be able to really seal this stuff in your mind. So pause this one and see if you can get the right answer. Remember, we talked about in vitro and in vivo, right? Okay, remember, we talked about the in vivo. Those are things that happen inside the body that have nothing to do with what the phlebotomist did, right? Like snake bites and heart valve replacements and transfusion reactions. Then there's the in vitro issues that are things that happen outside the body. These are the things that the person drawing the blood, the phlebotomist, it can do that can cause that blood to hemolyze. And we talked about when we're using those really small needles, if you pull back too hard on that plunger, on that syringe, it will shred those cells and hemolyze your specimen. We know that whether we're drawing venous blood or capillary blood, not allowing that alcohol to dry can cause it. And remember, using a small gauge needle and those really big vacutainer tubes, not only can they blow your patient's vein, okay, but they can also cause hemolysis. So guys, make sure you're getting this in vitro issue and in vivo issue down. So that's it on our capillary, okay? So we've covered this, we've covered it in lab, and we will continue to cover it in lab as we continue to practice our capillary skin punctures, collecting blood into micro containers, micro hematocrit tubes, and collecting our slides and making our slides. So guys, remember, if this is not clicking with you, if there's something that you heard that you say, I don't remember that, or I'm not getting it, please, guys, we can talk in lab. You're welcome to text me, email me, or call me, right? So remember, in this chapter, we always want to make sure we understand what our objectives and goals are when we study. What am I supposed to learn, right? Well, we covered how much blood can be safely drawn from infants, right? Because we need to make sure we are not compounding a problem. If this patient is already severely anemic, then we want to be very careful how much blood we take from them. And if this patient has a lower blood volume, as in a neonatal or an infant or a child, then we want to keep up with and work with our other healthcare providers to make sure that we're keeping up with how much blood we're taking from this patient, right? Okay, and we talked about skin puncture and when it can be used, when it shouldn't be used. We talked about the composition of capillary blood versus venous blood and why that is so important to notify our doctor and our nurses on the source that specimen came from, right? We talked about blood smears, how to make them, okay? And we talked about how to perform the skin puncture. Okay, guys, now all your chapters are up on Canvas, okay? So you guys should be, when it comes to lecture, you should already be reading those chapters, right? You should be reading those chapters. You should be watching the PowerPoint presentations, filling out your review guides, and then using those review guides to study. Okay, those review guides are located for lecture in your black binder, right? And make sure you get down your listings. Also remember, in lab, we're starting on those next chapters, right? So as soon as you take that lab test, then you want to mark that off your tentative course calendar, flip over, find your next lecture test and your next lab test, circle them, right? And then you want to start studying them. And remember, in lecture, which we're doing right now, our review guides are in our black binder, and in lab, our chapters that we read and our review guides are in the white lab binder. And so for lab, we read those chapters, fill out those review guides, and study those, including Appendix A that is located in your white lab binder. And remember, now we're down to turning in a case study every week. So when you come in, you will have that case study. You will drop it in the black basket at front. And we always leave some time at the end of class to go over that case study. And then anything that you guys are missing, I'm trying to make you understand why you're missing it and get your mind in the right frame of mind to understand how to do them. Because remember, you have to pass all your tests, average of a 70% or better in lab and lecture. And also in lecture, you have to pass with a 70% or better at least 5 of your case studies to get out of this class, right? So you guys have a great day. And if you have any issues or anything you don't understand, please reach out to me as soon as you can. Have a great day.